Gout. Because the big toe is heated, swollen, and sensitive, some people may experience severe pain attacks. These symptoms could signal a serious case of gout, a type of arthritis caused by the accumulation of uric acid in the body's joints. Men are more sensitive to gout than women, and women are more likely to acquire it after menopause. Symptoms of gout. Gout symptoms manifest as acute bouts that frequently occur at night and involve the following. Joint discomfort that is severe. Gout primarily affects the large joint in the big thumb of the palm of the foot, but it can also affect other joints in the body, including those in the palm of the foot, ankles, knees, hands, and pelvis. An acute attack of pain lasts 5 to 10 days, and if the condition is not treated, it may reappear. Redness and inflammation. The swollen joint or set of joints turns red and reactive to any object that comes into contact with it. Gout causes and risk factors. Because of the high concentration of uric acid in the blood, gout is caused by the buildup of uric acid crystals around the joint, which causes inflammation and acute pain in the area. Uric acid is produced by the body as part of the purine breakdown process, which is one of the amino acids present naturally in the body and in specific foods like beef, asparagus, and mushrooms. Uric acid is expelled from the body through the kidneys, but in some circumstances where the body produces a lot of it or the kidneys only discharge a little, uric acid builds up in the form of pointed, needle-like crystals inside the joint or surrounding tissues, producing gout infection. Factors that make you more likely to get gout. Many reasons can contribute to an increase in uric acid levels in the body, including the following. Lifestyle. Eating too much meat and drinking too much alcohol causes uric acid to build up in the body. Medical issues. Many medical issues raise the risk of acquiring gout, including 1. High blood pressure. Diabetes type 2, diabetes. Hypercholesterolemia, high cholesterol. 4. Cardiovascular disease. Taking certain medications. Certain medications produce an increase in uric acid levels in the blood, such as Thiazide, for starters. 2. Aspirin. 3. Anti-immune rejection medications are available. Gout in the family, if there is a history of gout in the family. Age and gender. Gout is more common in men, especially in their early years of life, whereas symptoms and signs of gout develop in women after menopause. Gout complications. Gout can cause a variety of significant problems, including the following. Gout attacks on a regular basis. Symptoms getting worse over time. Stones in the kidneys. Diagnosis of gout. Gout can be diagnosed using a variety of tests, including the ones listed below. Synovial fluid. Synovia fluid in the joints is examined. A blood sample. Treatment for gout. Gout is treated using a variety of drugs, and the doctor selects the best course of action based on the patient's condition. The following drugs are among them. Nonsteroidal anti-inflammatory medications, NSAIDs. Colchicine is an antibiotic. Anabolic steroids. Gout treatment. There are various steps that can be performed to lower the risk of gout, including: take some prescription drugs. Doctors may advise persons who have gout attacks on a regular basis or who are experiencing worsening gout symptoms to use drugs that minimize the risk of future attacks. After the gout attack has passed, this preventive treatment is started. This type of treatment seeks to either inhibit uric acid production in the body or improve the process of uric acid excretion. Eat a certain diet. Although it has not been established that certain dietary changes might reduce the chance of acquiring gout, it is logical that consuming foods with the least amount of purine can help prevent the condition from worsening. Therefore, it is recommended to follow the following guidelines. Limiting red meat and seafood consumption. Limit your intake of alcoholic beverages. An excessive intake of low-fat dairy products. Consumption of complex carbs such as whole grain bread in excess. It is important to remember that you should eat enough food to maintain a healthy weight, as rapid weight loss causes a spike in uric acid levels. Alternative medicine. There are a variety of complementary and alternative therapies that can be utilized when traditional treatments fail to produce the intended effects, but you should check with your doctor first to determine if they interact poorly with the prescriptions you are taking. The following are examples of complementary treatments. Coffee consumption, both regular and decaffeinated, lowers uric acid levels in the blood, however scientists are not sure why. C. Vitamin. Some food additives, as well as meals containing vitamin C, may lower uric acid levels in the blood. However, there is insufficient evidence to suggest that it is useful as a gout treatment, and taking high amounts of it may produce a rise in uric acid levels in the blood. Cherry. Cherries and other dark fruits, such as blackberries, blues, and purple grapes, may help to lower uric acid levels in the blood, but it is best to talk to your doctor first.